Hello colleagues, my name is Jipego, a Master of Science Economic student at Copperbelt University, here to present my research findings for the research topic Determinants of Malaria Prevalence among Adolescents in High Transmission Regions in Northern Zambia. The study focused on adolescents in Northern Zambia. Basically, the abstract is adolescents in malaria endemic areas remain understudied despite being at high risk. The study investigates the socioeconomic, environmental, and behavioral factors influencing malaria prevalence among adolescents in the age 10 to 19. It applies the socioeconomic model and high health belief model. The findings revealed that high socioeconomic status adolescents had 44% lower malaria risk, and risk increased by 12% annually with age. Insecticide-treated nets provided a 32% risk reduction, or proximity to stagnant water increased risk by 45%. The study emphasized targeted, specific age, and gender-sensitive interventions. The problem statement. Adolescents account nearly 23% of Zambia's population but remain neglected in malaria strategies. National programs have focused on children under 5 and pregnant women, overlooking adolescents' specific behaviors, environmental exposures, and health system gaps. There is therefore limited data on how social and environmental determinants like poverty, gender, location influence adolescent malaria risk. On the methodology, the cross-sectional study design using 2018 Malaria Indicator Survey was adopted for the study. A sample of 881 adolescents from Wapula, Northern Province, were sampled for the study. Analysis techniques, a multivariable logistic regression was used, using the fixed effects models, and generalized estimating equation was developed. Propensity score matching was also considered. The key variables were age, gender, socioeconomic status, use of insecticide-treated nets, indoor residual spray, and proximity to stagnant water. The key findings of the study were that malaria risks increased by 12% per year of age. High socioeconomic status adolescents had 44% lower odds of infection. ITN use reduced malaria risks by 32%. Proximity to stagnant water raised risks by 45%. Female adolescents from high socioeconomic status households had 38% lower risk compared to low socioeconomic peers. Recommendations. Targeted adolescents in malaria programming and surveillance. Recommendations were made that the strategies we should target adolescents should be developed so as to sensitize them more on malaria prevention and intervention. Strengthen school-based malaria education and net distribution. Design gender-responsive and socioeconomic status-sensitive health interventions. Engage adolescents in environmental cleanup campaigns and community-led malaria preventions. Implement age-disaggregated monitoring and data collection. Conclusion. Adolescents face unique intersectional malaria risks due to age, gender, socioeconomic status conditions, and the environment. Despite the effectiveness of ITNs and indoor residual spray, moderate coverage and usage suggests gaps in implementation. Malaria programs must adopt integrated adolescent-centered strategies to break the cycle of vulnerability and reduce disease burden. This marks the end of my presentation. Thank you very much for attention.